Many of you will know that as of January this year, the WSIB is now covering chronic mental stress as a workplace injury. And that is in addition to what we previously covered in the area of mental health related compensation, the other areas being traumatic mental stress associated with a traumatic incident or injury, and also PTSD. So we've been in the business of providing insurance and compensation coverage for people who suffer from mental health related conditions for some time. So that's an important part of our business, and we've built up a program to be prepared for that, and we're in the midst now of dealing with claims that are coming in, and so that's a very important part of our work. I just wanted to speak for a little bit about what we know based on our business, which is much broader than that. Mental health issues are prevalent in every workplace, and there will be lots of cases that aren't covered by the WSIB and might be otherwise covered by another benefit plan, or they might not be covered because you might not have another benefit plan. But they're important workplace-related, or they may not be workplace-related, but they're in your workplace. They're in my workplace. I can tell you at the WSIB, the number one reason why staff can be off on short-term disability is because of mental health-related incidents. Some of them related to work, and many of them not. Many of them related to other circumstances of people's lives. But they significantly impact the way our workplace operates. Yes, because we have to deal with the management side of time, but they're also because they impact the human beings that are part of our culture and part of who we are, and those incidents impact them in very different ways than a physical injury might. They require different kinds of accommodations or different kinds of care. And they also require different kinds of expertise to be aware of them. That's a learning that we've gone through as an employer, but also as we've become ready to set up our program to deal with chronic mental stress. How can we understand the conditions better, make sure that we have the resources available to help us manage claims, having psychiatrists and psychologists across the province, but also understanding, for example, that today, and I didn't know this until we were going through more and more learning. All of the executives at the WSIB have gone through a mental health training program put on by our benefits provider, Morneau Chappelle, in conjunction with Queen's University. And all of our staff are going through training. On one hand, to help manage mental health related claims or incidents, but also as part of that, to be more aware, to understand how we interact with individuals who are suffering from those kinds of conditions. Today, almost 90% of the diagnoses of mental health conditions are done today by a primary care doctor or nurse practitioner, not by a psychiatrist or a psychologist. Now, some will say, well, that's, are we sure that doctors are trained enough to do that? Well, I think most are. It's in the scope of practice of doctors. And yes, there is special care that psychiatrists and psychologists bring. But one of the benefits and one of the things that we need to know is that part of the reason why, and we were told doctors are making those diagnoses themselves, is because they themselves don't want to wait for a referral to a specialist. They want their patient to get care as quickly as they can. And in our experience, and I think you probably experienced it as employers yourself, the sooner you get intervention and care, the more likely the scenario of a reintegration back into work and getting a care plan in place and getting the proper interventions in place. And the longer you wait, and it doesn't matter whether it's a mental health related injury or a physical injury, the longer you wait, the more challenging it will be to have a reintegration back into the workplace. And so one of the things we've learned, and I'd say to all of you, is to bear that in mind, because our experience, another area we've had to deal with, or we've dealt with mental health conditions before chronic mental stress has come, is we often will see, in relation to a physical injury, the manifestation of a mental health issue arise later on. Injury or the recovery is taking longer, there's depression sets in. All of those things make it harder to get back to work, make it harder for an individual to get back to work and cope with their injury or illness. So there are things that we really need to be aware of, we're trying to be aware of, and one of the things that we know we have to do and hopefully are going to continue to get better at is to work with all of you as employers to help you with the, we have a lot of data, and that's one of the things that we can use, is all of the data we have to help inform you. It's, I think, one of the biggest questions that we faced when the chronic mental stress was coming in. What are you going to do to help us? Because we don't know exactly, or many employers don't know exactly what to do, because it is a new area. It is a new area for all of us. One of the things we're seeing already in relation to our mental stress claims, and it's very early days, but you'll know that there's an exclusion in coverage in relation to a mental health issue that may arise as a result of the employer exercising their management rights. So if it's a management exercise of proper exercise of authority in relation to allocation of work or discipline, that's not covered as a compensable injury. But you need to know that even though it may not be covered by us, there are lots of cases happening where there's a mental health issue arising. So just because it's not covered by us doesn't mean there aren't issues that exist. And I know you know that, but that's one of the things we're seeing is there are cases that come that might not be covered, and one of the worries we have is, if it's not covered, how do we help employers recognize that they still need to watch for the cases, because the cases are still existing in their workplace, and they're cases then that the employers will have to manage. And if not managed, they may develop into bigger situations than you might think at the outset. There are some cases or some incidents that you should probably watch for, because they might develop into something. So take a policing, so if you're, and I'll use a policing example and then how it might apply in your workplace. Policing authorities now understand, as do firefighters, for example, that if their firefighters or police have to attend at certain kinds of crime scenes or accident scenes or certain kinds of incidents, that they need to watch for signals for something developing later. Mm-hmm. It's not just that it might, if you go and then you leave the incident and you're good to go. You've got to watch, because things will develop, and same as in other workplaces. I mean, for example, chronic mental stress or PTSD, one of the things we see, or traumatic mental stress, significant incidents in workplaces can cause stress and can cause conditions to develop later, whether there's a traumatic event, whether there's cases of bullying and harassment that unchecked go on and can create conditions later. And so it's not simply enough to address the cause, as important as that is, but also I think you as health and safety experts can also help your workplaces to know, this happened, we've dealt with the incident. We should keep our eye on how that worker manages that in the future, as they go forward. is there any stress that just is coming from that we should be aware of? Or a stressor that we might know isn't workplace related, but that happens outside, that, whether it's the death of a loved one, whether it's another incident that happened outside the workplace that you're aware of. What we do know is these things don't happen just like that, but they may develop over time. So I'll speak first from the perspective of WSIB and some of the tools that we've been trying to provide in conjunction with our responsibility and mandate, which continues to have a strong focus on promoting health and safety. So there are a few tools that we are trying to expand on and we've created. One is a tool called Compass. Some of you are probably aware of it, have heard of it. It's a tool that we introduced last year to start to make public data that it's otherwise publicly available data, otherwise data that was going to have to be more publicly available in response to the government's open data requirements. So what we tried to do is to make the data openly available in a more constructive and user-friendly way to allow individuals, workplaces, young people to look at the tool that provides a little bit of a snapshot of the health and safety performance of individual employers against a few metrics. It's not digging deep inside the employer to disclose information that would otherwise be confidential, but it does highlight some information about how many incidents they may have had, what kinds of incidents they are, how their record may have changed over time. And it gives some ability for a young person or anyone to look and say, okay, here's a snapshot of a little bit of information. So that's one tool that gives a bit more granular information. Certainly, we're going to continue to try and evolve that tool. And some of the evolution of that tool will actually be to provide more information to you as employers that actually will be confidential and not accessible to the public. So you can even dig down more deeply into your own health and safety performance, because we think it's important for us to be adding more and more value to you so that you can understand at a more granular way what is driving your costs, what kinds of injuries are most prevalent, maybe not just in your workplace, but across industries, so that we can always be working with you to help promote health and safety. Another thing I would say, picking up on the presentation before ours, Rob, is to try and get some assessment of the culture. When you're sitting down having that interview, to ask, what does the CEO think? What does the CEO say, or does the CEO say anything about health and safety? Is it that important? Because I think you're totally right. I think the extent to which the leaders in organizations speak about health and safety as an important element of what their business is about, that's critically important. For you as people who are interviewing young people, don't be afraid to talk about it as a differentiator for you as an employer, that health and safety is really important. You might want to think about us. Why? Because when you come to work for us, it's an important part of what we think about. It's interesting. One of the exercises that we're going through as an organization right now is to finalize a strategic plan that will take us forward for the next 3 to 5 years, but it's not just a 3 to 5 year plan. It's a 3 to 5 year plan that has some longer term goals in mind. And as part of that exercise, we've been asking ourselves, what is our job really about? If you cut away, because over 110 years of being in business, you tend to get focused on a lot of different things, and some of them really aren't necessarily always aligned to the objectives you want today. And so one of the interesting things about that exercise is we've stood back and said, well, okay, what is our real job? What is it that we are supposed to do? in simple terms. And you can go read the legislation, but that's not very simple. Those are not very simple terms. So, we kind of, we concluded that and this more than anybody. So the devastation or disruption that can happen from a workplace injury or illness is sometimes unimaginable, and it's a disruption or devastation that happens to a number of different people that are involved in work. It happens to the employer, it happens to the families, it happens to the workers, it happens to the society at large. And our job, as best that we can, is to eliminate or minimize that disruption or devastation. Mm-hmm. How we do that will differ depending on who we're interacting with. But that's our job in very simple terms. We have to eliminate or minimize that devastation or disruption. So, the measures of how we do that, one is to ask ourselves, some simple questions. One is, are we actually doing something that is making workplaces safer? And in a lot of ways we are. But I still know that, and I get an email every time we get a claim set up when someone is killed in a workplace incident. And I've had 3 in the last 2 weeks. Our numbers are sadly pretty steady over the course of the last number of years, despite everything we're doing to try and make workplaces safer. And I think we are making them safer. And I think there's no doubt Ontario is one of the safest places to work in the world, but there's still a lot more to do. Mm-hmm. And so that's, to me, what would my goal be? That's one. And the other is then to make the interactions that the people who are our customers, their interactions with us easier, because I think probably goes without saying for many of you, your interactions with us at times are not all that easy. When you look right down to what our business is about, is eliminating that devastation or disruption that happens. When that happens, we have to make that process easier, whoever we're dealing with at any particular time. So those are some of the, the 2 high level goals that we have to deal with. Those are critical.